Chief Medical Officer Dr. Hazel Laws and Chief of Staff at the Genève Hospital, Dr. Cameron Wilkinson, continue to encourage the public to take the AstraZeneca vaccine that is now available at health centers across the Federation. On Monday, St. Kitts and Nevis received 20,000 doses of the COVID Shield Oxford AstraZeneca vaccines from India. Based on this donation, the health authorities indicate that anyone in the Federation can now get their doses of the vaccine, as it is not limited only to frontline workers.
We have received 20,000 doses of AstraZeneca Oxford vaccine. So we received 2,000 a few weeks ago, and so yesterday we received an additional amount. And so because of the amount of doses that we have in hand, we have now rolled it out to everybody. So if you're in a priority group in phase 2 or phase 3, which we would have explained to the public before, you can walk into any of the health centers and access same. And so last week we would have rolled it out in the Newtown Health Center, Basdale Health Center, Sandy Point, and Tabernacle. And so we are hoping to begin administering the vaccine in Cayon, Molyneux, Old Road, St. Paul's, and soon after the additional 2, which would be the Dieppe Bay and Sadler's Health Center. In Nevis, we started at 3 health centers, Charlestown, Gingerland, and Combermere. As of this week, we are rolling it out in all 6 health centers in Nevis. And so wherever you are, if you've made up in your mind that, hey, I want my jab, you could just go to the nearest health center, make an appointment, and if perchance, there is a slot for that same day, chances are you will be receiving your first jab on that same day.
And so, in other words, initially when we only had 2,000 doses, we were giving priority to the essential workers. But with the extra 20,000, although your name might be further down on the priority list, there is no time difference. You can have it the same time as the essential worker. And it's important for us to realize that every person who is vaccinated brings us one step closer towards herd immunity. So every person who goes there, they are doing a job, they're doing something good, not just for themselves, but for the entire Federation.
And so now that we have more doses in hand, you don't even have to call 311. You can just go to your nearest health center and request the vaccine. We are vaccinating in the afternoon, starting at 1 o'clock each afternoon.
Speaking on Tuesday's edition of Issues radio program on Freedom FM, both Dr. Wilkinson and Dr. Laws answered questions and concerns from the public as it relates to the COVID-19 vaccine.
Select our new system and use our environment to deal with this crisis.
Are the protocols going to be released a little for the traveling public when they would have received their 2 doses of the vaccine?
Some quick questions. Why can't below 18 take the vaccine, right? That's the first question. Now, persons, you said we had about 40 cases of COVID in St. Kitts. Does these 40 has immunity?
We're not trying to force anything down on any persons. And we have also said that we're asking for an all-of-society approach in this education process. And so the education doesn't have to come from myself or Dr. Laws. We're asking every single healthcare professional out there, every single person who has knowledge about the disease, to help to share the information, because I might come on the radio and try and say something to convince you, but you might not follow what I say, but you might listen to your neighbor and your friend. There's a caller that asks as why it's not given to persons below the age of 18, because it wasn't tested in persons below the age of 18, and these persons generally do much better than older persons. However, there are current trials that are taking place now in persons under 18, and until there's a vaccine that gets authorization for use under 18, it will not be used.
Intent to ask about the 41 confirmed cases that we would have reported, and yes, they would have they are imported cases. Some of them have gone back to the countries where they came from, but yes, they would have had natural immunity against the virus, having contracted it themselves. How long it will last? The science is still out on that, meaning how long does natural immunity last? I think he asked if it's for a lifetime.
No, it's not.
It's not.
The antibodies start to drop after 90 days, and that is why it's recommended that if somebody recovers, they can get the vaccination after they recover, or up to 90 days after?
And then he went on to ask about our protocols and if somebody would receive the full dosing schedule, meaning the first and the second dose within 10 weeks, if they travel and return to the Federation, if they would have to quarantine. And the answer to that is, for now, yes. And that protocol can change, but the changing of that protocol lies in our hands.
With countries around the world receiving vaccines, it is the hope that with the majority of the global population vaccinated, the world economy can gradually return to normal. In St. Kitts and Nevis, the health authorities are hoping that at least 70% of the St. Kitts and Nevis population would be vaccinated to develop herd immunity to the coronavirus. Dr. Laws noted that this would form most persons over the age of 18 years, as currently the vaccine is not being administered to persons who are below this age range. I'm Andre Huey for SKN Newsline.